Welcome to Revive Rehab channel. My name is Darly Thoppil and today we are going to talk about pelvic alignment. And this is for all my patients who have asked me so many times to put this on a video. So here you go. So when we are talking about pelvic alignment, I'm going to place this on you. Is that okay? We are talking about the alignment of these three bones, the two ilium and the sacrum. So this joint, which is the sacroiliac joint, and the pubic symphysis, which is what we are talking about, how to align it. Lot of the problems, if the pelvis is not aligned, the problems that you would have would be low back pain, neck pain, leg pain, sciatica. So it's a very useful technique to use if you are doing this correctly. I would highly recommend that you see a therapist before you start doing this on your own. So the first 2 points that a patient can completely do by themselves is this 2 point. The first point is the top of the iliac crest. And the second point that you're going to check is this most bony prominence on the iliac crest, which is called as the ASIS, or the anterior superior iliac spine. Right underneath there is this notch, and your thumb like fits in there. So those are the 2 points that you're going to check. So I wanted to show this on a skeleton so you will have an idea of how it is on a real person. So let's talk about the iliac crest. The way you find the top of the iliac crest is you're going to go below the rib, go in, and then place your hand directly on top of the iliac crest. And as you can see that Kristen's left ilium is higher than the right. When I talk about it's higher, it means her left ilium is closer to her head. I'm not talking about higher in this plane, like closer to the ceiling. I'm talking about higher towards her head. So she definitely has a left ilium upslip. So let's go ahead and fix that, and then we're going to come and check this to see if she has a rotation. So in order to fix that, you're going to come to the base of her feet. So you ask the patient, or you do not need a therapist to be here to do this alignment. I'm here just to show you, but you can do this without the resistance. So Kristen, I want you to push this leg down and hike this hip up at the same time. I'm going to count till 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're going to do that 3 times. Again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And one more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you stop. And now you have to go back and check if the ilium came down. So you do the same thing. You go in, and then she is down, but it's not perfect, just 1 millimeter up. So I'm going to repeat this till it's perfect. Okay, Kristen, push left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, 2, 3, 4, 5, 6, 7, 8, 9, 10. One more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. You have to go back and check it again. You go in, and then you place your finger right on top of the ilium, and now you can see that it's perfect, it's leveled. Okay, so she doesn't have an upslip anymore. So now you come back and you check for this other point, the ASIS. So I'm going to ask her to bend her knees, because bending the knees make this bone jut out even more than what it is. So I find this bone right here, and then I go below the bone into that notch. And if you can see here, she's slightly lower on the right hand side, okay, which means she is slightly rotated on the right ilium has actually gone forward. Since this is leveled, and if this point is slightly down, it means that this has rotated forwards. So in order to fix this, what you're going to do is, I'm going to take your socks off, Kristen. So you're going to put your foot right here, and you're going to lift this leg, and I want you to push. The angle of the push is going to be right there. I want you to push your right leg on your left thigh and hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, another one. 1, 2, 3, 4, 6, 7, 8, 9, 10. One more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you bring it down, and of course you have to recheck it. So I'm going to come back to the ASIS, and now it's perfect. It was a very mild rotation, so all it took is one time, and so it's in one line now. Okay, so this aligns the two SI joints, but you still have the pubic symphysis that needs to be aligned. So either you put a thick fat pillow in between your thighs, or in this case I'm just going to use my hands, and you ask the patient to squeeze it. Squeeze. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again. 1, 2, 3, 5, 6, 7, 8, 9, 10. And one more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And sometimes you would hear a pop that happens, or a grind, and that's perfectly normal because that's your pubic symphysis going back into alignment. And that's how you align your pelvis. Thank you.